All right, welcome back to Daybreak. It's now 7 minutes past 7 o'clock. We will shortly be speaking to the Cabinet Secretary in charge of Public Service, that is Professor Margaret Kobia. But before we do so, I want to take you through the latest in as far as the coronavirus pandemic in the country is concerned. Today is day 102. Of course, we've been, this week we'll be talking about the 100 days of coronavirus, the lessons that you've learned and the misses. I just want us to take a look at some of those slides that we have so far. Now, we know that we have 4,738 positive cases detected in the country. Out of that, 1,607 have recovered, 123 have died, and therefore the active cases are 3,008 cases. Most of these are not in hospitals. They're in isolation centers, or some of them have been discharged from hospitals to go through home-based care, and therefore the total tests, or rather samples that have been tested so far is 140,000, and beyond that we know that in as far as the war is concerned, the Kenya's worst week is what we just concluded yesterday, because the cases a week ago were 3,594. The cases as of yesterday were 4,738, and that's an increase of 1,144. This is the highest in any week since March 13th. The new deaths, 23 people died during the week, because at the close of last week we were at 100. Now we are at 123, and the new recoveries would appear to be 386. These are people that have recovered over the past 1 week. Let's now look at how the weeks have been behaving since the first 10 days. The first 10 days of the pandemic, we reported 15 cases. Now we are reporting what you can see there on your screen. It moved to 27, then 100, then excuse me, then week 4 was 55, and that has been rising consistently since the 8th week, from 207 to 215 to 327, which doubled the following week to 748, then 805, and then 827 the past week, the week before last, and then now the week that concluded yesterday would appear to be the highest at 1,144 cases that have been reported. So the curve you can see is rising, and the leaders at the Ministry of Health are saying that we have started the approach to the peak now. Let's take a look at the monthly, the monthly cases that have been reported. The month of March, we had 59 cases reported. On average, that was 3 cases a day. In April, we had 337 cases reported. On average, that would appear to have been 11. The month of May, 1,566 cases were reported. That's an average of 50 cases every day. And now in June alone, 2,776 cases have been reported. That's very high average, daily average of 132. Of course, the ministry is saying that this is because more testing is being done. Now, so far, over the past 100 days, 40 counties have been affected. Majority of them reporting at least 1 case. The latest to join that list should have been Vihiga, which joined the list last week. And then Nairobi leads with the rate of infection, or the disease burden, at 48%, that is 2,293. Mombasa has 1,273, which is 27%. Busia follows with 342 cases, most of them being truck drivers. That's 7% of the disease burden in the country. Kajiado has 178, which is 4%, and Kiambu has 151, which is 3%. The rest of the counties share 14% in accumulation. Now, you remember that when we started the war against the coronavirus disease, most of the infections were coming from outside the country. But now this has changed, because the disease is now at the community level, community transmission they call it, and so far 92% of the infections we have been transmitted within the country, what you call local transmission. For the imported cases, it's still at 8%. This has been changing on a daily basis. Let's listen into what the Cabinet Secretary in charge of Health Affairs said yesterday as the country was marking the situation of 100 days of the coronavirus. We begin with what he spoke yesterday in regards to that.
Kuna makosa mengi tulifanya, na kuna watu tulipeleka quarantine ambao waliumia sana, lakini sisi kusema tu pole, kwa sababu sisi ni binadamu na mengi tulikuwa hatujui. Lakini Mungu ametusaidia, ametujalia, tumeendelea na kujifunza na kuwa ya kwamba sio tu Nairobi sasa ambao tunaweza saidia watu. Counties zimeendelea kujenga capacity yao.
Cabinet Secretary also spoke about what we have learned over the past 100 days, but also looking ahead what we should be expecting in the coming days. Let's listen in.
The coronavirus will be with us for a long time, and that it will, in all probability, eventually stretch our medical system just as it has globally, even in the wealthiest nations.
All right, so that's the Cabinet Secretary in charge of Health Affairs, Mutahi Kagwe, speaking about the 100 days of coronavirus pandemic in the country. We'll shortly be speaking to the Cabinet Secretary in charge of Public Service, but as we do so, we're trying to prep her. As we do so, of course, this week is the, or tomorrow, we have the United Nations Public Service Week. Public Service Day, that is a day picked to celebrate the gains that are being made by the public servants in what they're doing. And this week it will be paying special focus to the public servants who have been dealing with containing the coronavirus pandemic in different parts of the country. So unfortunately, this is the first time that that day will be marked virtually. In the initial year, in past years, what has been happening is that there are celebrations being held at the headquarters of the United Nations. But now this time, because of the pandemic, that will have to be done remotely, and different players will be joining in virtually. You can also join if you go to the United Nations website. You'll be in a position to see how you'll be in a position to join that. So I still want us to speak to the Cabinet Secretary, that is Professor Margaret Kobia, on what that means. And the country has also been affected by public servants being asked to work from home, especially those that are past 58 years and those that would be suffering from pre-existing conditions that would put them at the risk of adverse effects should they get infected. Now, Cabinet Secretary is ready for us. Professor Margaret Kobia, good morning. And how are you keeping now? Right, I didn't hear that, Cabinet Secretary. I say good morning.
Good morning, Sam. You can hear me now?
Yes, I can. And Waziri, let's talk about what is just about to happen yesterday, the commemoration of the United Nations Public Service Day. What are we celebrating this time, and what do you think should be the take-home for the public service and Kenyans at large?
Thank you, Sam. Today is the 23rd June, and every year, 23rd June is called African Public Service Day, where what it means, Public Service Day, is looking at what services government provides, and we are looking at the services ranging from health, education, infrastructure, and the security, all the services that the citizens go to government offices to ask. Therefore, the African Union decided 23rd June be a day where all member states will come together and celebrate African Service Day by reflecting how well do we provide these services, and what lessons can we learn, what are the innovations. Some, I would also like to say the strength of any government depends on the kind of public service that they have. And that's why you find when governments come into power, they organize themselves in the ministries to give each a mandate and then serve the citizen through that. Therefore, tomorrow we are celebrating, today we are celebrating the African Public Service Day, and every ministry, every government department and agency has decided what they want to showcase as one of the services that they provide.
Right, and Waziri, we know that public service has been affected by the COVID-19 since the situation was reported on the 13th of March 2020. So it's been more than 100 days. What would you say has been the impact on how service is being delivered, bearing in mind that we have also had to ask some officers not to really report to work and work from elsewhere?
Thank you, Sam. I would also like us to appreciate that it is the public service that is in the forefront of responding to COVID-19. Therefore, since this is an emergency, it also goes to show that to what extent is the government leadership and with this public service can be able to respond to some of these impacts. Therefore, since it was a crisis and globally no government was prepared, with the leadership of His Excellency the President, first when the crisis was understood, the government sat and decided what structure do we use to be able to respond to these challenges? Of course, you do realize that people could no longer go to the office, because you realize the Ministry of Health very quickly came up with the consultation and collaboration of the whole of government with the measures that let's wash hands, let's wear a mask, let's do social distance, and let's stay at home. That means the public services were very affected. Therefore, we did realize the public services that are most affected are those which were not online. Therefore, people have to learn and adopt working from home. Services that render themselves from being worked from home are going on, and services that are online through Huduma centers are also going on. And also realize those in the front line as health workers are also public servants. Therefore, you can see those in the medical sector have been working very long hours, of course with challenges, because now they needed the PPEs, they needed to cope with curfew. Even those who are managing the curfew are part of the entire public service. So there have been big kind of impact, disruption in fact, but in that process that we have learned how to cope with the pandemic and at the same time how to practice the responses. Yes, Sam.
And Waziri, we've been seeing some COVID-19 cases being reported in some of the public sectors. We've seen some cases reported at different police stations. We've seen now KDF is getting affected. You've seen last week Mombasa locals were affected with 11 cases reported and therefore had to shut down. Have we had this affecting offices in the public sector, especially from the executive side?
Some, of course, since we all now are getting to understand this pandemic, COVID-19, not all of us knew, we are learning along the way. So we have realized, of course, one of the most important way of really not spreading it as fast is social distancing. Therefore, we realize that like prison, like disciplinary forces or any offices, actually anybody can get it if you do not practice the measures. So what we have done, of course, we came up with a guideline directing how in the offices, the spaces that we need in the meeting, and so that nobody is near each other. We are trying to do 1.5 meters, but you can see some places like maybe prison, it might be difficult. But within the executive, we are trying the social distancing. We are using the virtual meetings, and that is also, we are learning quite a lot, because we have also improved our infrastructure to be able to move, to keep, to be able to practice the measures that the Ministry of Health has come up with.
Right, of course, we'll continue to monitor the impact of all this in as far as service delivery is concerned. I don't know if you have any areas that you'll be celebrating this time round, but even as we do so, tell us about a few weeks, is it days or weeks ago? I think it's weeks. You released a letter when the Kirinyaga County Assembly impeached Governor Anne Waiguru, and he said that there are some people that are not very happy with strong women leadership. What exactly did you mean with that?
Yes, what we mean is, of course, we have always, as a State Department of Gender, our core focus is gender equality, where we are working towards equal world, and of course, equal world starts with the countries. Therefore, when you look at how women and men have the opportunity opportunities socially, economically, culturally, and politically, you can see for sure that one gender is disadvantaged. And that's why our constitution is very clear that when you are doing elective or appointed position, let's make an effort to get that %. Therefore, when we find a few women who have been able to scale the very stiff curve of getting to leadership position, when we see some difficulties, we are very much concerned. And of course, the reason why we find women not being able to be at the top of the leadership is because of patriarchal thinking that most of us, when people hear a woman in the leadership, an MP, a president, a minister, they think a man. I think that is the orientation we have. And this is not a Kenyan perspective only. That's why we have even SDG, that is the Sustainable Development Goals. There's a goal number 5 for gender equality and women empowerment. that is clear that globally the female gender is disadvantaged. So what I say that Governor Waiguru, some of us, and it's true, and I can stand by it, some of us as a population of Kenya, as a population of the world, we do not sometimes, when women are very strong in their leadership, to when a woman is aggressive, it is viewed negatively. When a man is aggressive, it's not the same. Therefore, what I said is when Governor Waiguru was impeached, I just demanded due process. And I think that due process, I'm seeing it through Senate, and where she will be given an opportunity to be heard. She was not heard at the county level through the MCA. They may have their own reasons, but what we demanded, and I can see already, after Governor Waiguru has been impeached and now moving to Senate, a lot of other MCAs from Kitui are gathering signatures to impeach Governor Gilu. What does that tell you? It tells you women leadership becomes a easy target. The things they are being blamed on, which I also say, if you have done something wrong and it's on the table, they should be held accountable. But if they are not being given a fair hearing, then we cannot blame them. And that means we have a long way to really prepare female as leaders. And even when they get this position, how do they sustain this position at that level?
Waziri, there are those that feel that your letter was ill-timed because that's the time the Assembly had just made a decision, yet the procedure of impeaching or removing a governor by impeachment is well set out in law. People would accuse you of meddling with the issues that are per se political.
Sam, I don't agree as meddling. That is part of what I strongly feel, that she should have been given a fair hearing right at the county level. That is what is in the law. Therefore, it's not meandering, it's just being able to bring these issues on the table so that we can start seeing that pattern that is emerging. Every woman who is at a senior position is a target, and when this impeachment, or not only that, whenever women are even as VCs in the university, you see they are becoming easy targets. And when they are attacked that way, then they may not want to take up leadership position. Or even those who are behind, they will not see it. They will see it like a position that people are not given a fair chance, because some of the things women are blamed for doing also happen with men. Therefore, what I'm saying, let's stay in the right path. Let's give women a fair chance. But there is a general perception from the citizen that women are easier targets. If you want them to impeach, it becomes very easy. So I think we must also start thinking, we come up with a law for impeaching people, which is equal for everyone. And I think that's what is required. Yes, Sam.
All right. As we conclude this, I don't know whether you have any final thoughts on the question I had asked you about the celebrations tomorrow. If there's anything that we're picking out. I saw a letter saying that you'll be planting trees somewhere. What is the take home this time round?
Thank you, Sam. I think first of all, I want to thank all the public servants, and especially those who are in the front line of the COVID pandemic, because of the way they have given themselves selflessly to serve during this COVID. And all the other public service, wherever they are, public services are calling. I'm also calling upon them to recommit themselves. And I'm also saying that every ministry must be able to do an activity that they feel it has helped them learn, or there's an innovation. Just tomorrow, we mark it at Gong Forest. We want to plant trees. The reason why we chose trees, because of the effect of the climate change. And what we are seeing affecting the livelihood of very many people, the effect of climate change, the drought, the floods, and even the sicknesses that are come, sometimes we are saying is because of the effect of the climate change. So we are saying we need to plant more trees. We will be there with the Minister of Youth, we will be there with the Minister of Environment, so that we can plant as many trees as possible, and not only plant, but also take care of them, so that we can have a better environment, which I think planting tree to get 10% tree cover is very critical. Sam?
Thank you so much, Professor Margaret Kobia. She is the Cabinet Secretary in charge of Public Service and Gender Affairs, and she speaks very openly there, that saying that some of the actions that are being conducted in different counties would appear to be targeting the women in the wrong way. We'll be having that conversation later with the Kuru Court. We'll be looking at some of the impeachment motions. The impeachment motion we've seen in Kitui, we'll be looking at it and drawing the line between politics versus the law shortly after. We take a short break. We'll return with that.